Hi, my name is Melissa Allen. I'm taking pharmacology that started on January 8th, 2019. In this scenario, the patient was 54 years old and she was disoriented, very combative, angry. Someone tried to help her in the park because they realized that she was very disoriented. The reason that she could have been was a fight or flight response. Now, the fight or flight response is the reaction in the body when faced by a sudden threat or source of stress has been used to describe activation of the sympathetic nervous system during emergencies. And that's from our textbook, Moini, 2018. This could be part of the reason that she was very disoriented and screaming at the person that was trying to help her. Another reason is the sympathetic system has to do with your blood vessels, your heart rate, your blood pressure rising. Also could have to do with her bladder muscles and how they're working, and also how she produces insulin. So she could have fallen because her insulin was not producing enough and her blood sugar was very high, which would cause someone to be dizzy and very disoriented, and also could do with her blood pressure, which possibly was very high due to her heart rate. When the EMTs got to her, the EMTs were trying to help her and take her to the ED, and she blamed them for stealing her purse, which most likely she didn't have one, but because she was disoriented, she probably thought she had one. So then she blamed them. And then when she got to the ED, she was still very disoriented and very combative. They said that she smelled of urine and body odor, which could be because her raised blood pressure would cause anybody to sweat. When you exercise, your heart rate increases, and then it causes you to sweat. And also, we don't know how long she was out in the park or in the streets. You know, how long has she been missing or not missing? Maybe she's homeless. So that could be the reason that she's very dirty. Now, the smell of urine, the sympathetic nervous system has to do with the bladder and the constricting and constriction of her bladder. So she could have been urinating on herself whenever her bladder released and she wasn't aware that she was urinating on herself. So that could be the cause of her smelling of urine. Now, the beta 1 and 2 receptors are most likely for the smell of body odor and urine. Those are the things that cause your heart rate to increase and also your bladder to not work properly. The beta 1 receptors have to do with your heart rate, but the beta 2 has to do with the bladder. So if they thought they could get their patient to calm down, her glucose levels, they could get those leveled out and her heart rate calm down, she could become less combative and they would be able to communicate with her better and possibly find out who she was, or if she even had a home. The things that they could do is take her blood pressure, see if her heart rate is lowering, check her insulin levels, make sure she, if they've gotten her insulin leveled, is she diabetic? Do they need to give her insulin? Will that help her regulate and become less combative? And also they need to ask her if she knows her own name or what day of the week it is or what month it is, what year it is. If she knows where she lives. And if she doesn't know any of those things, then we would need to contact the police and find out whether there's a missing persons report out on her. So to the research question. So mental health and insurance. So I currently take Effexor for anxiety and depression, and the medication works wonderful for me, and I'm pretty lucky. My insurance is wonderful. My OBGYN actually gave it to me, and it has helped me tremendously, but not everybody is as lucky as I am. Some people have to go through a process of getting a prior authorization, and they're not always easy to get. Mental health has not always been something that is always been covered by insurance, and if it is, they have to get a prior authorization. Sometimes that can take a very long time, and some patients don't have that time to give. They need some relief now. So if that's the case, then hopefully maybe your doctor can prescribe something until you're able to get that prior authorization, or you can get an appointment to see a psychiatrist, a counselor, whoever it is that they recommend you go see. Now, my insurance, I'm pretty lucky that it's just a different copay depending on who I'm going to see. And I feel like that should be the same for everybody. Everybody should have, okay, this set of doctors is going to be this copay. This set of doctors is going to be this copay. If you need to go see a psychiatrist, you get 10 visits for the whole year. And if you need more, then it becomes a prior authorization. But you already know that in advance. And I think that would help a lot of people out, as if everything was set and standardized over all the insurance companies. So I hope what I told you is information you're looking for, or I hope I told you something different. Thank you so much.